Hello there once again and welcome to The Verdict. Mick Cornett with Kent Myers. We're here every week meeting interesting people and dealing with topical issues, and we welcome in Bruce Lawrence today from Integris.
Yes, the president and CEO of Integris Health, Bruce Lawrence, is going to join us. We've been trying to get our schedules worked out where we could accommodate this, and finally did, and we're really pleased to have Bruce. I know he's a busy guy, and he's going to come talk to us about not only what's going on at Integris specifically, but what's kind of going on in healthcare generally.
A very large network of health-related services, a major player in the state of Oklahoma. We'll hear from Bruce Lawrence, the president and CEO of Integris Health, coming up today on The Verdict.
When someone looks at me, they looked at the disability before they look at the person.
Nothing builds esteem like having a job and being able to provide for yourself.
At Goodwill, we turn donations and resources into jobs.
It's so much that a person can do with a disability that's beyond our wildest dreams.
The parallel between repurposing things and repurposing people lies in seeing the value.
If you give me a chance, I won't let you down.
The resources that we are now seeing from Chesapeake, which did start with a financial contribution, has grown into other resources. They are willing to have their staff provide time, energy, expertise. Chesapeake opens doors for Goodwill. It is the right example to give to people who are refashioning their lives, and their future is brighter.
If you need big accounting firm expertise but aren't happy with the value or level of partner engagement from your current national firm, contact Hogan Taylor. Hogan Taylor provides national-level public accounting expertise with high-touch, local partner service in all areas of tax, audit, business valuation, and litigation support. Contact us at hogantaylor.com/The Verdict. Hogan Taylor, big enough to know, small enough to care.
Welcome back to the set of The Verdict. Mick Cornett with Kent Myers, and Kent's going to introduce today's guest.
Today, we're really pleased, as I indicated in the first segment, to welcome to the set of The Verdict Bruce Lawrence, who's president and CEO of Integris Health here in Oklahoma. Bruce did his undergraduate work at the University of Arkansas, did his master's work at Trinity University in San Antonio. He served in hospital areas in both Alabama and Arkansas before coming to Oklahoma in 2001. He joined Integris in 2001. Since then, he's been very active not only at the Integris level, but in the community and the state in civic and charitable and cultural activities. Been a contributor every place he has been. This is his first visit to The Verdict. We're really pleased you join us.
Thank you. It's a pleasure to be here.
I lose track. How many years at Integris and how many years as CEO now? Is this a couple of years in this position?
It'll be 3 years in January as CEO and 12 years in December at Integris.
All right. Well, how's it going in the new role?
Well, it's going well. Healthcare is under a lot of pressure right now, as everyone knows. But this organization is very strong. We've been around for many, many years providing care for Oklahomans, and we'll continue to do so in spite of all the adversities that we're facing.
Incredible expansion through the years to set up this entire statewide network. What's the future hold in that regard?
You know, I think that we're going to see across the healthcare industry more expansions as it becomes more difficult to provide care at the local level, and the cost structures have to be enhanced to be able to provide high quality care, because we know our reimbursements are going to continue to go down. That's going to lend itself for more opportunities for mergers, acquisitions, and expansions in order to get an economy of scale. You know, we at Integris kind of led that effort across the state of Oklahoma back many years ago. And while, you know, it's hard to say what the next 5 years is going to look like, I think you will see more strategic alignments starting to occur.
We're, of course, taping this before the pivotal November election. It'll air after the election. But
Right.
as we sit here before the election, what are kind of your, as president and CEO, near-term priorities? What are you focusing on now? I realize that could change.
Sure. Well, for the past 2.5 years, we've been focused on the Affordable Care Act and the provisions that are in that act and what that means for health systems and hospitals particularly. We know that there's going to be reduced reimbursement for Medicare over the next 10 years. That's built into the law. There's some real positive things that are built into the law as well, giving people without insurance today the opportunity to have insurance. And so we've been trying to position our organization for that reduction in reimbursement over time, but also with the growth of potential patients in Oklahoma who haven't had access to health care, who will have access to health care under the law. A lot of work goes into that. As you can imagine, anytime you look at trying to take cost out of any operation, you start to run into things that makes that difficult. But I'm very proud of our team and the focus that they've had on identifying what those efforts are for us.
You know, there's urbanization taking place around the world. People are moving to cities, and how that relates to your job, I'm sure, is that you have a lot of small communities that might have had a hospital when they had twice the population a decade or 2 decades ago. But today it's more and more difficult for any organization to be able to provide the expectation of health care. How do you deal with that on a personal and a professional basis?
Well, it is difficult. It's particularly difficult to recruit physicians into small rural communities. Unless a physician or their spouse has a tie with rural America or rural Oklahoma, it's very difficult to get them to want to relocate there. But without physicians, we cannot have quality health care provided in those communities. So that creates a real dilemma for us. In Oklahoma particularly, we see a lot of poverty in the smaller rural communities. That's where the expansion of Medicaid is going to be vitally important, I believe, to keep those facilities open and viable in the future.
Talk to our viewers a little bit about what expansion plans you may have, at least that you can disclose at the time, either in Oklahoma City area or statewide.
Sure. You know, currently we don't have anything that we have on our plate right now in terms of expansion. What we're been more focused on is looking at alignment. You know, how can we partner with or align with our physicians? And I'm very, very proud. At Integris, we have a clinical integration network with about 800 physicians in the metropolitan Oklahoma City area. That group has come together for the specific purpose of being able to improve quality and reduce the overall cost of care for a population that they're taking care of. And you know, now about 1/4 of those 800 physicians are employed by Integris, but the others are independent practitioners. And I think those types of alignment where the physicians did not want to be employed but knew that they needed to partner with a health system to be able to meet those ultimate outcomes is very, very powerful, and we've been very pleased with that.
Let me follow up on that just a minute. I have the impression that the hospitals employing a substantial number of physicians is relatively new, that in the past, maybe 15, 20 years ago, that didn't happen much. Most of the doctors just had privileges, but were independent. Is that something that you've seen increase in the past decade, and do you expect further increase?
It has increased in the past decade, and you know, 10 years ago, the employment model for physicians was mostly primary care physicians sought employment. Today, we're seeing as many specialty physicians as we do primary care physicians seeking to become employed. And they're doing it for a number of reasons. They're seeing their reimbursements go down. They're seeing their cost of operating their offices go up. And how can they continue to be there and provide that high quality care for their patients that their patients deserve, and still be able to have a margin for themselves, and to be able to have their staff and provide those services. And I think it will continue. The majority of people, the vast majority of people graduating from medical school today are only looking at an employment model. Very few of the young physicians coming into practice today want to go out, hang a shingle, and you know, work to build a practice like their peers did many, many years ago.
A lot of job descriptions under the Integris umbrella. Where are the job shortages? What areas of medical care are you just not having enough young people who are qualified to fill those roles?
You know, we've seen a shortage in nursing for several years in this country. And there's been a major push by the healthcare industry and the nursing associations to get more young people interested in nursing as a career. And we're starting to see some increases in young people going into nursing school, which is a great thing, because at the end of the day, that nurse at the bedside is one of the most critical players in the overall healthcare delivery process. So we need to continue to work on recruitment of nurses. Others highly trained technical areas, radiology, technology, pharmacy, respiratory, those are also areas that we see. And then we can't underestimate the physician shortage. You know, there have been studies that have been published that indicate that the number of doctors coming online in the next 10 years compared to those that are going to be retiring does not match. And so particularly, kind of getting back to the rural areas of America, there's going to be a real shortage of getting good quality physicians in those locations.
Let me jump in and get us to a break. We're visiting with Bruce Lawrence, the President and CEO of Integris. We'll be right back.
The thing that has made the most sense for me is realizing that I am still an educator, and that is what I do at the Chickasaw Nation. I'm Dr. Amanda Cobb-Greetham. I'm a historian, and I'm Chickasaw. The Chickasaw Cultural Center is amazing. It is a very, very special place devoted to the sharing and to the celebration of Chickasaw history and culture. State-of-the-art technology, exhibits that are not like anything I've ever seen. The Spirit Forest is incredible, and you feel as if you have actually just walked into a forest with huge trees all around you. It's timeless, and yet it's sort of also representative of our time depth, to really just sort of reach through time and touch the past. By the end of the exhibits, you really have a sense of Chickasaw cultural and political resurgence, and the extent to which we are a healthy, dynamic, and vital tribe today. Chickasaws have always been an inclusive people. This is something for the whole community and for the state of Oklahoma.
They lift, grip, and bear pressure. They carry our state through every season. Hands that simply by doing their job, forge opportunity for nearly 350,000. These are the hands of Oklahoma's oil and natural gas industry, working sun up to sundown for our economy, our future, for every person who lives where these flags wave.
When you have something important to communicate, it becomes clear that there's a lot of competition for your audience's attention. So how can your message stand out and actually resonate with your audience? Legal Graphics has the answers. The team at Legal Graphics will work with you to plan, design, and even test your presentation to ensure your message will be heard and remembered. Call Legal Graphics today to schedule an appointment. The readiness is all.
Welcome back to the set of the verdict. Mick Cornett and Kent Myers visiting with Bruce Lawrence of Integris Health.
Bruce, at the end of the last segment and at the break, you and I talked just a little bit about the recruiting that may go on and the recruiting of doctors and nurses by Integris. Explain to our viewers how that works.
Well, it's very competitive, and what you try to do as an employer is to create an environment where people will want to be there and work and practice if they're a physician. And so we have recruitment efforts through our Human Resources Department for all the positions that we have open and available. We go to job fairs and we go to schools and we reach out in that regard. As it relates to physicians, we do the same thing. We have active recruiters for both our metropolitan facilities as well as for our rural facilities. And you've got to constantly be out there talking about, you know, your message, your vision, your mission as an organization, and why you would like for them to come and join you in your system.
Is immigration a factor in that recruitment process for nurses or for other?
You know, not so much for nurses. For physicians, sometimes there'll be physicians from other countries that will come to America and get specialty training, and then they'll have a requirement to go and primarily work in a rural area for a period of time to work off that training requirement. And then if they're successful in getting permanent status, then we'll see them a lot of times want to stay in America.
Federal regulations, statutory, regulatory, it seems like they're always changing and evolving. How is Integris dealing with all of that?
Well, I would say the best we can. Healthcare is probably one of the most regulated industries, and I'm sure other professionals would think theirs is. Unfunded mandates hit healthcare, I believe, more than any other area.
What, like one or two?
A great example of that is a federal regulation called EMTALA, which has been on the books for many years. It basically says that if someone shows up in an emergency room in America today, you have to take them. You have to do a medical screening exam to determine if they have an emergent condition or not before you could ever ask for how are they going to pay for that service. That's just one of the many efforts.
And is that unique to the United States? Is that universal around the world, or are there other cultures that want to see the checkbook before they'll figure out what's wrong with you?
You know, in a lot of other countries, they have more of a universal health care, so everyone's covered, and so it's not that big of an issue. It's less of a factor.
Sure.
And it's not that we do not want to provide the care. We do want to provide the care, but it's just like, you know, there aren't many businesses that people walk through the door, load their basket up, and then get to the checkout counter, and then they say, well, we don't have the ability to pay, but we're going to go ahead and take the goods and services anyway. But that's sort of what we're faced with.
All right, let's talk about the technology and how that might relate to the rural areas and how that might be a more conducive situation.
You know, I think you've touched upon something there that's going to be able to enhance quality and access of care in rural Oklahoma and rural America. We've seen it for many years with radiology. The ability for a radiologist to be located in a centralized area like Oklahoma City or even anywhere in the world and be able to have images sent to them electronically. Our radiology equipment is so good now that they don't use film anymore. It's all electronic, it's all digital. And so those images can be sent to Oklahoma City or around the world and be read by a certified, board-certified radiologist. So we see that. We have a radiology residency program at Integris Baptist, and they've been very active in that. Another area that I'm really proud of is our telestroke program at Integris. We have across about 18 communities in Oklahoma today the ability, if a patient presents themselves in an emergency department with signs of a stroke, they can have a physician examine them in that emergency department. They can have a CT scan done of their brain, and then those images can be transferred electronically to a stroke-trained neurologist in Oklahoma City. And so within a matter of minutes, we can determine whether that patient is eligible for a stroke protocol or if it's something else that's going on with them. And we've just seen dramatic improvement in the quality of care as a result of that.
Well, that would be life-saving, would it not?
Absolutely life-saving.
That time that you save?
Yes, yes. I mean, time is of the essence because at the onset of a stroke, you only have a certain amount of time before you can start invigorating the treatment protocols to be able to try to reverse that.
I was at your location not long ago and waiting and picked up an article in a magazine that was talking about the changing face of the emergency room. It used to be that folks thought of the emergency room as where you went if you really had an emergency.
Right.
Not if you just wanted to get an examination or something else. I guess the face of the emergency room has changed.
Absolutely, absolutely, and we're delivering across this country today more primary care in that emergency room, and that's become necessary because a lot of those patients don't have any access to health insurance, and so without that, and without the ability to pay for their health care, they can't get a primary care physician. And so their last resort is to show up at an emergency room. And that's a major issue for not only Oklahoma, but that's a major issue for our country.
I noticed one aspect of the new health care law is, I won't get this exactly right, is preventive care.
Right.
And a free preventive care examination. And now the articles are coming out saying that won't make any difference, that preventive care this doesn't have any real value in preserving the health of an individual. What's your view about preventive care?
Well, I would take a different approach to that. I think preventive care is very important, and I think if we can meet an individual's basic needs and keep them from escalating or their care escalating to a point where those basic needs are just a minor part of what's going on and they have more significant chronic needs, we're going to spend much more money trying to take care of that patient at that point in time. You know, and in Oklahoma, I mean, look at the overall health status of Oklahoma. We're near the bottom of all 50 states. We've got to do something much like what the mayor has done for the city of Oklahoma City to raise awareness and to get people more active physically, eating the right types of foods, and taking care of their basic health.
Give me some numbers on Integris, size, scope, market share, whatever is readily available.
We have today in Oklahoma, we have 8 hospitals that we own and operate, 4 in the metropolitan area and 4 spread out around the state. We have a partnership with another organization for 5 more hospitals around the state. We have about 8,500 employees. We have about 400 physicians that are employed around the state. Another 400? About 400, goodness, yeah. And probably another 2,500 that practice in our facilities. We are Oklahoma's largest healthcare organization. In the metropolitan area, we have about 25% market share as it's measured. Oklahoma does not have requirements that people, it's a voluntary submission, I guess, of information, but our best guess is about that.
And just a few seconds left, but entirely in the state of Oklahoma?
Entirely in the state of Oklahoma.
Have you thought about expanding, or is that?
You know, with what's going on in healthcare and the need to look at alignments and partnerships, that's not off the thought of consideration, but we haven't aggressively pursued that.
All right.
I think we're
Bruce Lawrence.
out of time.
Okay.
Thanks very much. We are out of time.
Thank you.
Thank you for joining us, though. Bruce Lawrence with Integris Health. Kent and I'll have a final word when we get back.
The good life comes naturally to Tulsa, where nature's beauty is matched with an eye for aesthetics. A legacy of neighborhoods graced with lawns and landscaping and handsome homes. A place that seems to have patented an ideal lifestyle. Bank First is loyal to the quality of life Tulsa assures its citizens, to the priority placed on education, culture, and growth. Loyal to builders who transform raw land into residential charm. Developers who see opportunity and add vitality to Tulsa's economy. Bank First serves both enterprise and private lives that need a loyal partner. It's how we help nurture this city's very good life. Bank First. Loyal to Oklahoma. Loyal to you.
I think for us, once we got started and we began to see the tremendous need just within our state, it really was just a calling for us. The blessings far outweigh any obstacles that we've faced.
You will always be Mom and Dad to me.
All children deserve a life of hope and love. But sometimes they experience a life of pain, neglect, and abuse.
When that happens, each child deserves all the quality assistance and representation that can be offered in our legal system. For more information, call 23-CHILD.
Oklahoma Lawyers for Children, helping to bring hope and love back to the lives of abused children.
The Journal-Record is pleased to be a sponsor of The Verdict. The Journal-Record, since 1903, the best source of Oklahoma business news and legal information.
And for almost 30 years, Oklahoma political, government, and business leaders have turned to the McCarville Report for accurate, reliable, inside information. Visit the McCarville Report online.
Welcome back to the set of The Verdict. Mick Cornett and Kent Myers wrapping up a show with Bruce Lawrence, the president and CEO of Integris.
Yeah, Bruce has been on the job a little over 3 years now, and Integris has made huge strides in expanding the services that it offers the people in our community as well as the state in general, and more to come. I can speak personally that the treatment one can expect when you walk in the door of Integris is really outstanding. It's not something you want to do usually. You're there not because you chose to come, but because you needed to. And it's nice to have folks that take care of you, that obviously care about you and care what is the right thing to do for you. And what can be difficult experiences turn out better than they would otherwise. And Bruce emanates that from the top down, I know.
He does, and you could pick out elements of just what a tough business model it must be to be in that industry these days, because things are ever changing. The expectations keep raising, but so does the expectation that somebody else is going to pay for it.
Yes.
And that's just not a good situation to be the provider.
We didn't get to ask him, but I would like to ask him sometime. I mean, when you're out trying to hire a brain surgeon, how do you know how much to pay a brain surgeon? Because you don't know how much activity that brain surgeon is going to generate. Yeah. And in any event, I'm sure that's another show.
Well, it looks like Integris is in good hands. We appreciate Bruce coming on the show. And we appreciate you too. We have a couple of websites to pass along some information about. First of all, there's Bruce's website, integrisok.com. That's integrisok.com. And we have a website too. You can visit it and tell us about a guest or a subject matter you'd like to see discussed on a future edition of The Verdict. That website is theverdict.tv. That's going to do it. For Kent Myers, I'm Mick Cornett. We'll see you next week.
The preceding program was produced exclusively for the Cox Channel.